So the early days of this, our focus really was on making sure we didn't spread the disease to vulnerable people in nursing homes when we responded to calls. We also were concerned about our workforce resiliency. So we realized we had to start testing first responders so that we could understand how much the disease was spreading in our own ranks. So that's really how this got started for us, was by standing up a first responder clinic where we tested people that were either police or fire. And in doing so, we learned a workflow and became adept and efficient at using the equipment needed to test people. So we expanded our role into going into those same nursing homes when they were having outbreaks and helping them understand the scope of that infection and kind of trying to bring it under control. Learning how to do that taught us to be efficient in the testing process in a way that allowed us to partner with the city, with UW Medicine, and with AMR to open up these community testing sites so that our initial efforts, which now appear very modest, I mean, from March to June of last year, we tested roughly 550 first responders at our first responder clinic. On our busiest days at the community testing sites before Thanksgiving, we were testing 6,500 people a day. And in total now, since June, we've tested 707,000 people. This has been an extraordinary year for the Seattle Fire Department, stepping into a space that we never imagined we would occupy. I think all of us recognize our role as serving the public and public health in whatever way is needed, and it became increasingly apparent this year that there just weren't enough people in this space to do what needed to be done in terms of testing and vaccination. So we've been proud to take a lead role in that and kind of show other departments and agencies what's possible and share knowledge with other agencies that are trying to do similar work. It's been exciting this year to see the trust that we have from the community be extended to something like vaccines, where there's a lot of uncertainty around what's perceived as risky new technologies, what's perceived as a historically inequitable health system. And I feel like we've played a valuable role in helping people overcome some of those fears and concerns. I actually hope that this kind of larger public health focused service continues to be part of what we do as a fire service. I hope that we're able to expand the ways we think about how we help the community. I think for many of us, this has kind of opened our eyes to those possibilities. I know a lot of firefighters they've all gone through phases in doing this work. You know, initially, like the general population, people were very nervous about testing. They were nervous about going into these hot spots where they were having outbreaks. And it kind of took a minute to realize there's nobody else coming who can do this. We're the ones that have the PPE. We're not just going to shelter under our PPE until this is over. This is up to us to help do. And so for many of us, I think it's inspired a new level of confidence in our skills as medical providers. EMTs were not used to administering shots at this scale before now. And I can say that they're all getting pretty confident at delivering vaccines and delivering shots. I think more firefighters are becoming interested in medicine. I think we're also feeling more connected to our city partners. You know, this is not just a fire department project here. This involves the city at all levels. This is the mayor's office, this is FAS, this is the Office of Immigrant and Refugee Affairs, this is Department of Neighborhoods, this is Parks, this is SDOT. And so we're all been working together in a very close way. And so I feel like this has kind of improved our connection as city agencies. We are all feeling a lot of hope right now, and we all know we're racing against the variants, and we have to get as many shots and as many arms as we can before those variants continue to mutate and create new variants that are going to overcome all the hard-earned work we've accomplished. So I hope that everyone can hang in there a little longer, continue to be safe, get your vaccine, wear your mask, encourage your friends to get their vaccine and wear their masks, and we will get through this. We're getting closer.